How are you? All good? Well, my name is Dr. Maya, as you might know already. So, today you are here for a ASMR receptors test. All good. So, let me just tell you that today's exam is gonna be done by me and another doctor. So for the first part of your exam, I'll be testing your facial nerves and your smell receptors. For the second part, you will have another doctor. She will be really nice to you as well, I promise. And she will be testing your audition and your vision, I believe. So I will start with my part now, and then I will ask you to just head to the room next door, and she will be there waiting for you for the second part. Okay? Great. So let me just pick up my smell testers and we're gonna start right away. What do you think? Great. So for the smell receptors, you basically need to test if you are experiencing all the smells that you should, and this will also test a tiny bit of your audition. The rest of the audition test will be done with the other doctor, as I said, but we like to test small things along the way. So I will start with this one, and I will need you to identify all the smells, alright? You can hear that, right? Great. Okay. So, I just need you to identify the smell. That's very good. That's exactly what this is. Very good. I'm gonna take the second one. Okay. Are you able to listen to these sounds? Great. Okay. So I'm gonna need you to tell me what this is. That's great. That's really good. Okay. Next one. Are you ready? Okay. Next one will be a bit harder, and I'm hoping you can identify all the smells that I'm going to give you today. I just need to mix it up a little bit more. That should be good. So, if you could identify the smell. You are very good at this. That's correct, of course. Alright. Are you ready for the next one? I believe this will be... Oh, there's only this one and another one left. So you should be really good with this. Okay? So let me just mix this one. I want to make sure all the smells are good to go. That should be good. Okay. Time to test. If you could tell me what this is. It's a bit harder, isn't it? I'll mix it a bit more. Let's see. That is correct. Very good. You see, you're doing just fine. Yeah. And we're up to the last one. Are you ready for this one? Just gonna mix it really well. Okay, should be good to go. Let me see. Okay, that's great. So, if you could tell me what this is. Oh, that's great. You did all of them right. So, your smell receptors seem to be working really, really well. There is nothing to worry about. They are perfectly fine. You were able to identify all of the smells, so that's perfect. Okay, so next I will have to test your facial nerves. So for that I will just put my gloves on and I will start. Okay. Yeah, this is part of the procedure. I'm gonna touch your face, so it's safe to wear gloves. Okay. Are you ready? Do you mind if I just test your muscles, your facial receptors? Okay. So you seem to be doing great. Your facial receptors are so good. I can see that they are getting the tingles they should. So I don't see anything that could possibly be wrong. Yeah. Your facial receptors are really, really good. Yes, they are getting all of the tingles, and they are actually really, really good. I'm surprised. I haven't seen facial receptors like these in a long, long time. I'm really happy I'm just gonna keep testing because sometimes they have different reactions with the time passing by. Okay. So far, I'm really happy with them. Need to test all around your face. But you're doing great. Okay, so well, I am not worried at all. Facial receptors are splendid. They are working really well. I haven't seen these for a long time, so I am really happy. I would say that all your receptors are working 100%. But of course, we still need to test a few more things. But as I told you, I will not be the one doing that today. I believe my test is done. I'm really happy with all the results. So I think I'm going to pass you to my colleague, if you don't mind. I will just need you to step outside of the room, turn left, and you will find another ASMR room. And the doctor will be there waiting for you already. Yes. Okay. So, I think we're done for today. I'm really glad. So, as soon as you leave, I will enter your details on the system, and my colleague will have everything ready for you. She will take care of you, I believe. She's an amazing doctor. You're gonna love her. And you have nothing to worry about. Your receptors are splendid, as I told you before. So I hope I will see you again soon. It's always good to have you here. Okay, bye now.
Hello, welcome. Yes, Dr. Maya sent me your file. I've just seen it. It is great. I saw that your olfactory receptors and your facial nerves were working perfectly. Great, that is amazing. Okay, well, I am Dr. Carol. Nice to meet you. Today with me, we're going to be working with your audition, see how those receptors are, and your vision. So we're going to do a couple of tests, then we're going to do a joint one, but I'll show you later, don't worry. Great, we can start then. I'm going to start with your vision. I'm going to take my light, and I'm going to point it on your eye, okay? I know it may be quite uncomfortable, just try to relax, it won't last too long. Great. Okay, careful, I'm going to start. Do you mind if I get closer? Great, thank you. Okay, let's see. Just follow the light. Okay. Great. as I said, I know it might be quite uncomfortable. I'm trying not to do it too directly to your eyes. Okay, very good. Let me see that eye. Sorry, thank you. Okay, I'm gonna see how your pupils are working with my special light. It really helps. Let's see. Okay, it's reacting properly to the stimulation. That is perfect. Okay, great, very good. Let's try the other eye, see how it reacts to the stimulation. Yes, great. Okay, do you want to blink a couple times? Great, let's carry on. If at some point you feel too uncomfortable, you cannot carry on with the test, please let me know. Thank you. Great. Yes. Perfect. Very good. Very good. Okay, now both eyes. Okay. Again. Okay. Good. Very good. Now please follow the light. I'm going to step away from you. Please follow it. Yes, very good. 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 Sorry if you're feeling dizzy. We're about to end, so yes, we're about to finish now. Very good. Very good, that was great. Okay, I have my special laser here. Don't worry, cannot affect your vision. I'm just gonna try to find that sweet spot for the ASMR receptors. Here we are. There it is. Relax. Good. That's good. Yes, that is great. Your vision receptors were perfectly fine. That is great. Now, I'm going to work with your audition receptors. See how those nerves react. This is going to vibrate. I need you to tell me in which ear do you feel it. Okay? Great. Good. Close your eyes first. Of course, yes. Okay, I'm going to start. Okay, in which ear do you hear that? Great, very good. Let's try it again. Okay, in which ear do you hear that? Okay, Great, yes, that was it. Let's try this again. No picking. Okay, which ear? Great, let's try it again. Yes, you're right. I changed the ear. Very good. That was perfect. Very good indeed. Okay, close your eyes again, please. Okay. Does this create any kind of discomfort or no? Great. Good. And in this side, it's alright. Good. Okay. Yes, that is in front of you. You can open your eyes. Okay. So you didn't feel any kind of discomfort? Good. All tingles. Perfect. That is great. That is great. But for the last test, I would like to try this metronome with you. Okay? We're gonna try it first visually, and then you're going to tell me when you hear it. But first, the metronome, you need to follow it. Okay? I'm gonna make it go slower and then faster. Just follow it with your eyes. Great. Okay, now I'm gonna put it faster. I'm sorry, I know it might get you a little bit dizzy, but carry on, you're doing it perfectly. Okay, let's start. That was great. Yes, it was. Just blink a little bit if you feel a little bit dizzy. But your receptors were reacting perfectly. Yes. Okay, now we're going to test your audition receptors, see how they react. Okay, so I need you to lift a finger every time you hear it. Okay. Perfect. Okay, I'm gonna put it so it's faster. Perfect. That was perfect. Everything was working correctly. I am really happy. I'm going to send this to Dr. Maya so she has it on her file as well. But everything's working correctly. I am very happy for you. Yes. That's it. The test is done. So I would love to see you again, but if you don't come, I'll know that you're doing really well and that your ASMR receptors are working perfectly. Yes. Okay, thank you so much for coming. See you next time. Bye-bye.